Okay, today we're going to talk about Killian. Killian came for a follow-up after 6 months of his third hair transplant surgery. So Killian, by the way, is our patient coordinator for Ireland and the rest of the world. So welcome aboard. We're going to talk about Killian cases because he had the 3 surgeries here at our clinic, and the first one was 2015. We did a strip technique. The second one was about
3 years later.
3 years later. We did a small FUE technique. And the last one was 6 months ago. We did the strip technique again in conjunction with other supporting treatments, like we use the exosomes and the topical PRP. So I'm just going to show what we did last time. The last procedure, we focused on a few things. One of them is the temporal points. And if we look here, temporal points are so important in framing the face. And probably no one understands that better than Killian himself, because this is his desire. He wanted to have this nice shape. He wants to contour the eyebrows with the hairline, with the temporal points. That's why I think it's beautiful. What do you think? Are you happy with that?
I love the artistry of it.
Thank you. Thank you. So really it's important, the hair direction, the angulation, the density, the thin hair in the front and the thicker going backward. So it worked out really good, and I'm very pleased with that. By the way, it's still only 6 months and will get better and better with time. Also, we lowered the hairline a little bit. We refined it a little bit more to match his face. We did more work in filling some areas where he lost some of his native hair as a natural hair loss process. As we know, hair loss progressive with time, but we managed to do that with no problems because of one important thing we thought about at the very beginning, which is how to save and preserve the donor area. Probably not many people pay attention to that. Donor area is the supply. This is what we're going to need. So when we have a young patient coming to our clinic, we think 15, 20 years ahead. This is so important. We know that at one point, he or she will have some hair loss. So we're going to need this donor area. I have patients coming from other clinics, unfortunately, with depleted donor area. Young patients with completely depleted donor area. Look at it, you cannot take anything from it. And the worst of all is the hair direction is wrong, the density is not adequate. So sometimes we are stuck, what to do next? And we try our best to help those patients with some creativity, try to figure out using some body hair and so forth. But with Killian, we started the right way and we continued the right path. I just want to show you the way the area look. So the first procedure, we did the strip technique. So the scar was all the way to here. And if we look closer, so can't see anything really. The scar is undetectable. Because we use a trichophytic wound closure. He did his homework, he did his exercise to give the scalp more laxity. The second one, we did the FUE. We can see these hyperpigmentations, which is obvious after FUE. There's always some signs of surgery. If somebody tells you there's no scars, don't believe that. It's all marketing. FUE will always leave some little hyperpigmentation. The key is to try to spread these punches all over the place so it doesn't become like a big scar. So the third one, it was 6 months ago, we did another strip. It was a little bit shorter, but we did on the same old scar and we managed to get it perfect again because of the laxity, because of the trichophytic wound closure, because of our skills. We're doing this procedure for so many years and we are good at it. So guys, please do not be afraid of strip technique. FUT is still standard. It's a great technique. It preserves the donor area, and when it's done with the right in the right hands, with the right clinic, it's going to be great. And Killian is a big fan of it, I think.
Yeah, it was definitely the right choice.
People are afraid of pain or scars. What do you think? Did it really hurt? Maybe the first night or so?
You know, the ultimate thing is the final result. And the surgery itself is painless because you're under anaesthetic. And yes, FUT is more painful than FUE, but for a couple of days to a week.
Right.
And then after, you live with it forever. You live with that result and that donor preserved.
Great. So the results are great. Just want to show a little bit more of this new hairline. If you look here, we cannot see any gaps between the native hair and the transplanted hair.
I say you're probably struggling to get the comb through it, Marwan.
Yeah, I know. It's so thick here, so dense. All right, looks really great. I'm very pleased, and Killian is very happy. 6 months passed, and it will get better.
More to
every
come,
time.
more to mature.
Absolutely, absolutely. Thank you, folks, and we'll see you again.
See ya.